Varicocele is a cluster of varicose veins that occur around the testicle. In most of the time, the reason of the varicocele is the incompetence of the left internal spermatic vein that is located between the varicocele itself and the left renal vein. So there are two types of treatments. The first is surgery, and surgery can be divided into classic surgery and also microsurgery. And in classic surgery, the reason of the varicocele or the internal spermatic vein is ligated at the level of the groin, while in microsurgery, the testicle is taken out of the scrotum, and the small tiny vessels that makes up varicocele are ligated surgically. So there are two kinds of surgical treatments. An alternative treatment that has been in use for about 25 years is embolization, and now I would like to tell you more about the embolization because this is our favorite treatment, and we have been doing this treatment for varicocele patients for about 18 years. Embolization is a minimally invasive treatment option in varicocele. It is done under local anesthesia when the patient is awake with mild sedation. So we use standard angiography or some C-arm fluoroscopy machines for this procedure. We put the patient on the angiography table, and under ultrasound guidance, we either puncture the femoral vein or axillary vein. And then we put a catheter, and we search the refluxing vein, or we are trying to identify which vessel is responsible for the occurrence of varicocele. As I told you, in most of the time, the left internal spermatic vein that is located between the left renal vein and the varicocele is the responsible vein for varicocele. So during the intervention, we use angiography to identify this vessel. And after we enter the left renal vein with a diagnostic catheter, we ask the patient to strain. And when he strains, the intra-abdominal pressure increases, and so the reflux or backflow begins. And we can see this reflux on angiography screen like this. For example, in this patient, we entered the catheter from the groin, and we are now in the left internal spermatic vein, and we ask the patient to strain, and as you can see here, the dia we injected comes down into the varicocele around the testicle. So in this way, we can easily identify the reason of the varicocele, the refluxing vessel, and also we can see the varicocele itself. So what we do afterwards is to put a microcatheter through this catheter, and we advance the microcatheter into the varicocele here, and then we inject sort of foam, sclerosing material that we also use in the treatment of varicose veins. So we inject this foam into the varicocele, and in this way we treat the varicocele first, and then we withdraw the catheter into the refluxing vein or left internal spermatic vein, and we either advance some wires, microwires that we call coils, and in this way we occlude this vessel instead of ligating surgically, or we can inject a material like glue or cyanoacrylate into the vessel while the patient is performing Valsalva maneuver or straining. In this way, we can occlude the refluxing vessel, which is also the reason of the varicocele. So in short, unlike surgery, varicocele embolization is capable of treating both the varicocele and also the refluxing vessel that caused the varicocele in one single session. Thank you very much for your attention.